There's joy for the morning, oh sinner, be still. Earth has no sorrow that heaven can't heal. Earth has no sorrow that heaven can't heal. Lay down your burdens, lay down your shame. All who are broken, lift up your face. Oh, and you're not too far. So lay down your heart, lay down your heart, as you are.
Good afternoon, everybody. Now, my name is Serena, and I am a member of Cross Culture Church of Christ. On screen with me today, we have psychologist Angela Utomo and GP Carmen Yao. Today, the Caring Together Ministry of Cross Culture Church of Christ has kindly organised today's topic of understanding and caring in perinatal depression. We have the privilege of hearing today from both Carmen and Angela, who both attend Cross Culture Church of Christ. Carmen is married to John, and together they have one daughter, Eliza. Carmen is a GP with a strong interest in women's health, as well as children and adolescent health. Today, Carmen will be sharing about her journey of perinatal anxiety and the things she did that helped. Her husband, John, will also be sharing later on in today's presentation about how he, as a Christian partner, supported her through this journey. Angela, our psychologist, is married to Tristan, and together they have two children, Alora and Elijah. Angela has extensive background working with clients from different cultures, drawing upon their strengths to provide a holistic approach to their mental health care. Angela's interests include anxiety, depression, and trauma. Now today, Carmen and Angela will be talking about what perinatal depression and anxiety is and how it presents in its various forms. They will also be sharing about how somebody can care and support a person experiencing perinatal depression and anxiety from a Christian perspective. Now, in terms of housekeeping, the presentation today will be in the form of a webinar. You will have the opportunity to post questions during the presentation in the Q&A window at the bottom of your screen. Now, these will be raised anonymously at the end of the talk. Both the webinar and the Q&A will run for about an hour. After the Q&A, we will thank the speakers for their time and break out into small discussion groups, which will be gender specific. So if you are watching as a couple, please sign in using a separate device each. The discussion groups will run for approximately 30 minutes and they will be led by a facilitator. Now, without further ado, let me pray and I will hand over to Carmen and Angela. Dear Heavenly Father, as we look into the topic of perinatal depression and anxiety, we are well aware that there will be viewers who have experienced this or know someone that is currently experiencing it. Father, we pray that this time will be fruitful and that we will learn ways to help ourselves and help care for others struggling with perinatal depression or anxiety. We pray that the speakers can speak with sensitivity, wisdom, and insight. We pray, Lord, that you will bless the words that they speak. We ask all these things in Jesus' name. Amen. All right, over to you guys. Thank you.
Hey, thank you, Serena, for the introduction, and thank you, Constata, for the opportunity to share. I think this is such a timely topic, considering this week is actually Mental Health Awareness Week. And I think it's also a relevant topic because of the pandemic. Actually, very recent research published a couple of months ago identifies that around, among 900 Canadian women, there's a substantial increase in maternal depression and anxiety during the COVID-19 pandemic. So I think pre-pandemic, the percentage is around 5%, and then it's 40% currently. And for the anxiety, the pre-pandemic percentage is 29% before the pandemic, and it's around 72% of women currently. So although the term postnatal depression has increased in popularity among the community, for this presentation, I'm going to use the term perinatal mood and anxiety disorder, or PMAD. So we'll just go to the next slide. So this is the outline of what we're going to cover today. So I'll be talking about definitions, risk factors, where to get help, and how we can care. And I'll be sharing this together with Carmen. So next slide. Yeah, so what is perinatal? So perinatal refers to the time period from pregnancy right through to 12 months after childbirth, or the postnatal period. So this period can be stressful for women and men, and it's filled with a range of feelings, emotional ups and downs, and please know that this is normal. So many women will experience some symptoms of anxiety or depression during this period because of the uncertainty, baby doesn't come with a manual, there's increased responsibility, feelings of isolation and loneliness, and so on. But typically, this will pass and subside over time. However, sometimes these symptoms can turn into a mental health issue. So it can be excessive, intense, severe, and difficult to control. So we'll look at the definition provided by the DSM. So this is the Diagnostic Manual for Psychiatric Disorders. So because 50% of postpartum major depressive episodes actually begin prior to delivery, all these episodes are referred to collectively as peripartum episodes. So that's why it's better to use the term perinatal. So it's before and after the birth. So the symptoms of depression with peripartum onset include a depressed mood for at least 2 weeks, plus 5 or more of the following symptoms. So if you can look at the screen, some of the symptoms include feeling of sadness, loss of interest or pleasure in life, insomnia or hypersomnia, so difficulty with sleeping or sleeping too much, moving more slowly than usual, finding it harder to slow down than usual, loss of energy, really exhausted or fatigued, not feeling attached or bonded with your baby, feelings of worthlessness, guilt, feeling trapped, having issues with concentration, issues with making decisions, also some thoughts of either death, suicide, or self-harm. So the most common screening tool that is used to detect perinatal depression is called Antenatal Risk Questionnaire, or the Edinburgh Postnatal Depression Scale. So if you've gone to your maternal child health nurse or the midwife or obstetrician, you might have done this type of screening. And the screening will classify the disorder, whether it's mild, moderate, or severe, depending on the quantity, severity, and impact of your symptoms. Let's go to the next slide. So it's 1 in 5 women experience perinatal depression. So how about baby blues? So this is very common, what's the difference between baby blues and perinatal depression? So baby blues usually start a few days after birth, but it would resolve within 2 weeks. So anything that's longer than 2 weeks, you would want to pay more attention to, as it might be perinatal depression. And baby blues happen to around 80% of women after giving birth, because there's a very sudden drop or changes in hormones after delivering your baby. But typically no treatment is needed. With perinatal depression, it can happen anytime, up to 1 year after, and it's not going to get better unless you receive some form of treatment. All right, the next slide is about perinatal anxiety. So this is not specifically listed on the DSM-5, but it's quite common as well in the perinatal period. So around 1 in 5 women experience this. Some of the symptoms include feeling restless or feeling on the edge, uh, fearing that something bad is going to happen, excessive worry, difficulty controlling the worry, irritability, having a lot of tension in the muscle, in the body, sleep and appetite disturbance, panic attacks. But what really differentiated from depression is anxiety is a physiological arousal. So there's a lot of physical symptoms. So heart palpitations, sweaty hands, tummy pain, and so on. So it can present differently depending on you know people's experiences. Some of my clients would have more like of an OCD presentation, so obsessive compulsive disorder type of presentation. So they're constantly worry about the baby's health. Keep checking on their rashes. Worrying about choking, worrying about their breathing, keep checking on them whether they breathe at night or every time the baby sleeps and so on. But it's outside the scope of our presentation today. So perinatal anxiety and depression can happen together, and actually the rate is 50%. So the comorbidity rate is 50%. So it's quite common for someone who have perinatal depression to also have perinatal anxiety at the same time. I will hand over to Carmen to discuss her own experiences of perinatal anxiety.
Yeah, so thanks, Angela. So yeah, I obviously had perinatal anxiety, and I think pretty much all of the symptoms. The main one being that I was just really worried about something happening to the baby, or that I might do something to cause harm to the baby. So for me, it really started quite early on during the pregnancy, probably a week or so after I found out I was pregnant. So initially it'll be worries that I would be able to brush aside or talk myself through it rationally. But I think even as early on as my second trimester, the worries started to just consume a lot of my day. So things that I would be worried about was whether I was what I was eating was okay, was it safe, whether my baby was still alive. So I would always feel very nervous going to my next scan to find out whether, just worried that I might have had a late miscarriage or even a stillbirth. So I think, yeah, it just became quite difficult to control a lot of my worries. And as Angela said, it sort of became that I just developed a lot of checking behavior. So that obsessive compulsive behavior. So a lot of the time was, checking my baby's movements during the day. So being a GP, I have I have one of those old monitors that you can use to listen to babies' heartbeat. So I was often using that during my breaks. Or I would just stop in the middle of dinner, to lie on the couch just to see if my baby was moving. And then it became, and in terms of food, even though, as a doctor, I knew what foods were safe, what foods weren't safe, I would double, triple check everything. I would then Google about, many websites just to make sure that it was really safe. So I think it just became to a point that I was quite distracted and restless with all these worries. And it just became that I was not able to sleep well. So I had trouble sleeping. I would wake up in the middle of the night worried about the baby. So until I would feel baby move, I wouldn't be able to fall back to sleep. And thankfully, though, I think work was actually quite a good distraction for me. So I actually didn't feel that it affected my work at all. And I actually enjoyed work because it kept my mind away from it. Yeah, so I think it just got to a point where I was also quite worried that bad things would happen, bad things would happen. I had this fear of telling people that I was pregnant, partly because I didn't want them, what would happen if something was to happen to the baby, and then I'll have to tell them that something had happened to the baby. So the times that I found that were quite anxiety provoking was when I started to show. But thankfully for me, it actually started much later on. So I had to tell my patients that obviously they would ask whether I was pregnant, and I would have to say yes. And that would actually raise a lot of anxiety for me. I also, when I started receiving gifts from my patients and from people, which whilst was a very lovely gesture, it actually provoked a lot of anxiety, and a lot of the gifts actually stayed in. I hid them until much later on after I started on medication and felt a bit better. And I just remember, and there was one particular incident where I just remember John had booked a flight to go back overseas to visit his family sometime in early my third trimester. And the thought of something happening to him was so overwhelming that I actually asked him to cancel his flight, 3 days before he was due to leave. And he did. So I think, those things were just, it was quite overwhelming. I didn't have any depression symptoms as such, but obviously all of that, it did affect my mood. And I just didn't have any motivation to do things I used to like to do. So I stopped baking. I couldn't be bothered going for walks, things like that. So, yeah. So back to Angela.
Thanks, Carmen,
Yeah.
for sharing. Yeah. So as you heard from Carmen, parenting or even just pregnancy can bring a lot of high emotions, pressure, upheaval, but also it can bring immense joy and fulfillment. But because of the increased stress, women are more likely to develop mental health problems in this perinatal period than at any other life stage. Men are also at risk, so let's go to the next slide, particularly if their partner is also struggling. So there's not much data available, and the data that's available actually combine the depression and anxiety, but what's available is 1 in 10 new deaths actually experience perinatal mood and anxiety disorder. Some of the symptoms may look different in men. So I've listed common symptoms that research and also my male clients have reported. What would be different probably is, the tendency of overworking or pretty much can't function at work. A lot of fatigue. There's also, because I guess it's more acceptable for male to complain physically. There's a lot of reports of physical problems like headaches, shortness of breath, digestion issues, or pain. They're also more likely to engage in a more risky type of behavior, so alcohol and drug use, and sometimes extramarital affair. But there's also strong suicidal thoughts. So one of my clients said that, this is the second time dead. He wanted to pretty much just, drive into a tree because he can't bear the anxiety about having a second child. So there are a number of factors that can increase a person's risk of experiencing perinatal mental health problems, and these include environmental, physical, and psychological. So let's go to the next slide. So with the environment, I want to emphasize here that perinatal mood disorder can affect anyone. So whether you're a first-time parent, fifth-time parent, older, younger parents, whether you're a pastor, or just a congregation, it can affect anyone, and there's no, shame in that. So, having a mental health issue is not a failure. All right, so let's look at the environmental risk factors. So this would be having a stressful life event. So, losing your job, um, having relationship issues with your spouse, domestic violence. That's a really high risk factor for perinatal depression, anxiety. Um, what else? Coming from a non-English speaking background, if you live in Australia, feeling that at the moment it's not the right time, so unwanted pregnancy, or that can be a high risk for a perinatal mood and anxiety disorder. But with environmental, I think unbiblical expectations of motherhood can also be a really big risk factor. So if we go to the next slide, this is a joke that you probably have seen around social media, but how to become a mom in 2019 or 2020. So can we go to the next slide? So it says that, being a mom, you need to really attend to children's psychological, mental, spiritual, nutritional needs and so on. And you can read it yourself. And at the end, also don't forget coconut oil. So there's a lot of expectation from society for mothers and also fathers to be perfect. So even sometimes in the church community, we said that, being a mother, motherhood is the highest calling from God, and we need to, because it's such a blessing, we need to be grateful all the time and so on. And that put a lot of pressure on mom. So if we go back to the previous slide, sorry, I'm going back and forth. Yeah, this one. I just want to remind us that, our main purpose on earth is to love God and to know Him better. So being a mother or being a parent should not be our main sole identity or main service on earth. So godly parenthood should be the product of fulfilling our purpose, which is loving God and knowing Him better. So that's just a reminder. Psychological risk factor is pre-existing mental illness. So people with bipolar disorder or pre-existing anxiety and depression disorder, they're more likely to get diagnosed with perinatal mood and anxiety disorder, and also certain personality factors like low self-esteem, perfectionism. In terms of physical, so if you have a traumatic birth, a really difficult birth, or have a baby with health issues, such as, baby needing to be in ICU, if you have a lot of problems with breastfeeding, have severe sleep deprivation, that's also a risk factor. Do you want to add to that, Carmen, in terms of physical risk factor?
Certainly if you've had like fertility issues, so trouble conceiving and had or even just the hormonal fluctuations during pregnancy and after pregnancy itself. And I think one of the main things that impact people is obviously the lack of sleep. So which we'll probably talk a little bit about later in terms of how we can help with that. So yeah. Yeah, so I think for me, just to go back to how things came about for me, I think there were a few factors. I certainly didn't think I had anxiety during pregnancy, but my psychiatrist said I probably did, but had been able to keep it under control. So what they would call sort of high functioning anxiety, which is something that's quite commonly seen in my profession. I'm admittedly a bit of a control freak, and the way that I probably managed a lot of my anxiety in the past was actually to regain some sort of control in any situations. So the more uncertainty there was, the more anxious I became, and then the more I needed to find a way to regain control. So obviously with pregnancy, there's just so much uncertainty with it. So there's so much that we don't know, and there's just, there's nothing that we can get in control of. And the same in, after having a baby as well, you've got a baby in front of you and you just don't know what's going to happen next. So with that, along with all the fluctuating hormones that I was experiencing, for me, it became that perfect storm for everything to come to a head. So that was one reason. And I think the other thing was also that my personality. I guess I'm a perfectionist, and the way that it played with me was that we had been trying for some time to have a baby, and I had some fertility issues which were treated. The fact that I was pregnant, we were ecstatic. We knew that our families would be. So a baby would have been was the first grandchild on both sides of the family. So in my mind, I felt that if something were to go wrong, I would have let a lot of people down. So, and that, I mean, that was just how I thought. So I would have let John down, my parents down, his parents down, everyone who had been praying for me during this journey of me, of us having a baby. So I just felt like I had to make sure that I was doing everything perfectly. I was eating the right things. I was, making sure that everything was safe and doing everything the right way. And I think that created a lot of anxiety for me. Yeah. So, yeah. So, but I mean, there's lots of places that people can look at getting help. So I might get Angela to sort of briefly touch on that first, and then we'll come back.
Yeah. So we'll go to the 2 slides after this. Yeah, so where to get help. Next slide. So obviously GP would be your first person of contact. Carmen will talk more about it from GP's perspective, but also you can seek help from psychologists, midwife, obstetrician, maternal and child health, and nurse. So as I said before, usually you do get some sort of screening from your midwife or from your MCHN. If you require medication, then psychiatrist can be a good person to contact. But there's also, thankfully, plenty of community resources. So I'll just refer back to Carmen to talk about GP's perspective.
Yeah, so I guess, there's always a lot of help that's available. So I guess putting on my GP hat, a lot of the time as a GP, I might already know. So when people come in who are pregnant or who've had a baby, most of the time I would already know them. And that I might already know that there is a history of, of depression or anxiety or something else. Or if or at least if they don't have a history, I'll be able to notice a bit of a change in someone who I've been seeing quite regularly. The other way that I sometimes see patients is also when I get referred patients from either the hospital clinic where a lot of the pregnancy care has been done. So if someone has been seen at the hospital and the midwife or the doctor's been worried about them, I'll probably actually get a phone call from them just to follow up as their GP as well. Or sometimes, as Angela said, they'll be referred in by the maternal child health nurse. So they're the ones who see mums and dads and baby after the baby's been born, and usually around the 4-week mark, they'll do a quite extensive chat in terms of how the family's going. So usually around that time, I tend to get a few referrals. But otherwise, anytime that the maternal child health nurse might be worried, they'll usually send the mum, dad, baby in for a bit of a checkup. Or sometimes it could be that, and I've had this happen before, when mum's actually a bit worried about dad, and mum's actually come in to chat to me about something, just not quite right with their husband, and seeing what they could do to help encourage them to come in as well. So dads sometimes get a bit forgotten or lost in everything like this. So sometimes it's the wife who actually, or the mum who comes in to have a chat with me about it, and vice versa. So sometimes it's the husband or the partner who comes in, or other family members who are concerned. So I think the main point I want to make is really it's important during pregnancy and after pregnancy to not brush off any of the symptoms of depression or anxiety. The reason being is that some of these symptoms can also be symptoms of an underlying condition, which commonly is an overactive or underactive thyroid. So our thyroid is this gland in your neck, and it controls a lot of our, I guess, functions like metabolism, and it secretes hormones and controls a lot of those things. So sometimes when it's overactive and underactive, it can cause a lot of the symptoms that we've talked about with depression and anxiety. So I've had a few women who've come in thinking that they're either anxious or depressed, they're restless, they're not sleepy, they're very moody, and they've either lost weight, and it ended up being that their thyroid was actually overactive, which is something that we commonly sometimes happen a lot more frequently in Asian women. And once we treated them, they felt much better. So, and that was probably about six to 8 weeks after they had their baby, but it can certainly present much later on. So even 6 months, 9 months down the track as well. The other thing that we normally do as a GP is just to make sure, like, physically that you're going okay. So a lot of mums, either during pregnancy or after having baby, will have low iron, which, you know, in itself will make people feel quite tired. And so even just having an iron supplement or making sure that that's okay can actually help you feel less tired. And, you know, being tired itself just doesn't make anyone feel good at all. So being able to replenish that can be helpful. And otherwise, and what we can also do is also facilitate those referrals to a psychologist as well. So if you get a referral done through a GP, if you have a mental health condition, so if it's postnatal depression, perinatal anxiety, you will get subsidised visits to see a psychologist. And I think they've actually increased it to 20.
That's right.
20 now, isn't it, Angela?
20 now, from October.
Yeah. Yep. So you get 20 sessions where Medicare will subsidise part of the consultation fee. And that's actually really helpful for a lot of people as well. Yeah. So, and obviously sometimes you might need a referral, like some people might need to actually go on medication, which as a GP we can either start or monitor, or referral to a psychiatrist as well. Yeah. So I might hand over back to Angela to talk about how a psychologist can actually help, because I think a lot of people wonder, what can a psychologist actually do in this situation? Yeah.
Thanks, Carmen. So yeah, a lot of research actually has shown that combining medication with psychotherapy leads to the best outcome in terms of TMAT presentation. So I think also with medication, just want to let everyone know that you can take medication that's safe during breastfeeding as well and during pregnancy. That's right, Carmen? I'm pretty sure.
Correct.
Right.
Yeah.
Quite a few of my clients have taken medication that's safe during pregnancy or breastfeeding. So in terms of psychotherapy or talking therapy, the first line therapy for a woman experiencing mild to moderate episode of peripartum depression and anxiety is called CBT, or cognitive behavioral therapy. So CBT actually seeks to modify the way patients think about and react to their thoughts, symptoms, environment. The second one is called interpersonal therapy. So interpersonal therapy focuses on repairing relationships and circumstances that contribute to the depressive symptoms. So for example, working on the patient's emotions about motherhood or the motherhood role. And the last one is called a third wave behavior therapy. So this is a more recent one. It's called acceptance commitment therapy. So that looks at increasing someone's psychological flexibility. But as a psychologist, the two things that I would say if you want to, seek help or to treat perinatal depression, anxiety, is to make sure that you move your body. So psychologists call this behavioral activation. So exercising, engaging in pleasurable activity, engaging in stress reduction activities, trying to work on something that really valuable or something that you really value, that would help with depression, anxiety. And the second one would be trying to still your mind. So being careful about your thoughts, and trying to work with the thoughts. So things like mindfulness activities. So a lot of CBT activities, the cognitive behavioral therapy exercises that will be good in terms of keeping your mind still. So those are the two things for it: keeping your mind still and moving your body. In terms of community resources, thankfully in Australia we have a lot. So I've put in the next slide several organizations that provide resource in this area. So there's one specific for dads as well. I think one organization that I forgot to put is also called Gidget Foundation. They have a virtual peer-to-peer support group for expectant or new dads. So you can also check that out. So I believe this webinar is recorded, so you can refer back to this site to look at the community resources. So Carmen, do you want to talk about how you seek help?
Yeah, so well, I actually booked myself into a psychologist probably when I was around 14 weeks pregnant. So I think that was getting to the point of my peak. So because I knew it wasn't normal for me to be constantly worried about it, and I knew also that it would be better for me to get help before baby was born, just because there's a lot more stresses after the baby's born and a lot more hormones running around. So I think being a GP helped me to, and just having that interest in mental health, to not feel embarrassed about getting help. So I think there's still a big, I suppose, issue with stigma with getting help for a mental health condition. So whether it's, someone reaching out, to see a professional, or even talking to someone, as a friend or within the church about a mental health condition. So in my experience, I actually found the psychologist really helpful on a multiple fronts. So firstly, I found it was actually a safe place for me to talk about how I was feeling. So, being pregnant, having a first baby, there's this expectation that I should be completely filled with joy, and I should have all these positive feelings about it, should be excited, what are you going to do for your baby shower? What are you going to do for X, Y, and Z? Or have you bought clothes yet? Things like that. But I was actually just quite overwhelmed with everything, and I did not actually feel much of the joy. And I think with her, it was okay to say that, and okay to, just tell her, how worried I was, and be able to just have that validated, or empathize with. And also with the psychologist, it was quite helpful to actually find out why it happened in the first place. I think for me to understand that, my upbringing, personality, all played a part, and it was very eye-opening for me. And also having to then, just be able to go, look, this is what it is. We'll see what we can do to move forward as well. And as I mentioned before, I had a lot of the checking behavior. So at the peak of it, I was probably checking my baby's, I think I checked my baby's movements about 60 times a day, because I had to actually record how often I was doing it for her. So that was probably going on for about a good sort of 3-4 weeks. So she did very early on look at doing some exercises with me to help reduce those checking behaviors. But because of how intense they were, she actually suggested me to go and see a psychiatrist. So I ended up seeing a psychiatrist probably towards the end of my second trimester, so 27, 28 weeks. And he suggested that I go on medication. So we prayed about it. We, even as a GP, I know that the medication is very safe in pregnancy and in breastfeeding, but I think as it's still, I still could not help but to check, to make sure that it was okay. So eventually I started medication probably 5 weeks before Eliza was born, and it made a huge difference for me. So John actually noticed it first after about 2 weeks, where he could see that I was a bit more relaxed, and that I actually started baking again. I still remember feeling quite anxious, but my checking had actually over that time had dropped a little bit. And I actually felt like I was enjoying my pregnancy a bit more. So so the psychiatrist told me that to stay on the medication for 12 months. So since about July, August this year, I've been off it, and I did quite well after Eliza was born. I did have the baby blues, but I knew that obviously passed, and now I've been doing quite well since being off medication. And they think that there is possibly a chance that I'll probably can have another another like anxiety again, but we'll cross that bridge when the time comes. Yeah.
Thank you, Carmen. All right. So how can we care for those who might be going through this? So let's go to the next slide. Yeah. So, being trained in community psychology, I strongly believe that community is the foundation of wellness. So through generations, mothers transition to parenthood and raise their children together with their village. So they're being guided, they're being supported by either their own mothers, aunties, grandparents, people around them. But in today's society, mothers or dads are expected to pretty much do it all by themselves. So I want to emphasize here that church can play a really significant role as a community. So both in Ephesians 1:5-13, it says that when we place our hope in Christ's death and resurrection, we become God's children and we are one family. And in Matthew 16:18, it says that on this rock I will build my church and gates of hell shall not prevail. So, church is an excellent place as a community. We have grace, we have truth, and I believe that we can transform, people's lives with all of this together. So how can church or church members demonstrate loving biblical care? Well, can play a role as a supportive community. So let's go to the next slide. So first of all, being aware. So hopefully this presentation that Carmen and I gave give you that sense of, I guess information, knowledge, so you're more aware of the symptoms and the signs of depression and anxiety, and acknowledge when people share their experiences with you, acknowledge that it is a real mental health issue. It is a medical condition. I want to say it again, I think I said it before, that having a mental health issue is not a failure, but also perinatal depression or anxiety does not disqualify you to be a great parent or to be a woman or man full of faith. So sometimes people I guess struggle with this concept. We know that God is sovereign and in control, but why am I still worrying? So you can feel afraid and know that God is in control, or feel anxious and know that God is good, because sometimes we are not what we feel sometimes doesn't align with what our spirits know is the truth. But yeah, know that it doesn't disqualify you from being a good parent or man or woman full of faith. So grow in God, and serve God. So it's the same. If you have perinatal depression or anxiety, you can still know God, grow in God, and serve God.
Yeah.
So the second one is providing emotional, practical, spiritual support. The story about the lost sheep in Luke, and it says that Jesus came to seek and save the lost. So it is part of our earthly ministry to help others who are alone or forgotten in some way. So not just spiritually, making sure that they are safe, but this is the core value of the kingdom of God. So we do need to help in other ways as well. So actually, a study in 2016 found that emotional support from church members is related to fewer depressive symptoms. So this suggests that it's very important to get support from church members, and it does play a big role in women's and men's psychological well-being. So we can use the flower well-being model. Apologies for my excellent drawing here, but if you want to get a large paper and draw large petals and with a circle in the middle, you can write in the middle here the organizer for support. So it can be the man or woman's sister, or the life group leader, the best friend, or a pastor. But make sure that it's not the person that's affected by perinatal depression and anxiety. So, for example, Angela, and then on these 5 petals, you want to look at different areas. So body, so that's physical needs. So maybe write 2 different names. So like Carmen and Felice can organize a meal train, dropping off meals for this person, and then the next petal would be on emotion. So having 1 or 2 people to contact the mom affected by perinatal depression and offer emotional support. Mind or spirit. So I think during my pregnancy, I have one particular person from church that keeps asking me, what do you have prayer points? What kind of spiritual support, I guess, I need. So that has been really helpful. Social, and then nature. So maybe again having 1 or 2 person to that would encourage this mom or dad to go out, enjoy the sunshine, smell the spring. Vitamin D has been shown to be really effective in lifting depressive symptoms. Yeah. So Carmen will share with us about what doesn't help, I suppose.
Yeah, I just wanted to add the part about, I guess how God, even though I know God's in control, I can still worry. So, I mean, that's something that I struggled a lot with during my pregnancy. How can I, if I know that God is in control and that the child is God's, be so worried about everything? How do I let it go? And that I wrestled a lot with that. I certainly think that my faith is strong, but it didn't stop me from having these worries. And I think I came to realize that knowing God is in control doesn't actually mean that we don't worry about things. And that I came to realize that our worries and anxiety doesn't come from, all my worries and anxiety doesn't come from a lack of faith on my part as well. And I think what I found is that, I just trusted that God would carry me through the worries and during that time. And I believe that, I came, that we live in the broken world. There's not only physical illness, but there's certainly mental illness as well. But God will always be there to lead me through it, whether it be, through spiritual help, spiritually, or or either leading me to professionals or friends who can journey with me as well. So I think for me, my faith also yeah, just really was a rock during this time. You know, I kept falling back on who I know God to be. You know, He's a good God, and that He loves me so much. And I knew that I wasn't going through this because He wanted to punish me or to make things difficult for me. But it might be because, you know, it might be at some point, you know, my faith would be strengthened, and or it would be a testimony to bring Him glory in the end. Some days I did find it really hard to talk to and pray to God or read the Bible, because I was just too distracted. You know, I was too distracted trying to feel movements. I was too distracted thinking, what Google website can I look up? So it was actually really helpful for me to have John, my husband, reassure me with my worries and to actually remind me to pray. And he prayed with me as well when I couldn't. So he was actually a very great help. And I'll sort of go back a bit about that in a moment. So, because I think what he did to help was actually he just listened to me. He didn't dismiss any of my feelings, and he knew that those feelings were very real, and just kept reassuring me, no matter whether it was, you know, the first time he heard it or whether it was, you know, the 100th time he heard it. So I think just being able to acknowledge those feelings, and for someone, and not to tell them, offer any advice. I think that was the most helpful thing that people did for me, and or to give them, you know, and not to give me Bible verses to read. I think John and my colleagues at work who are actually Christians as well. They were very good in terms of just praying with me and just walking each week with me. So yeah, I think what Angela also mentioned about practical help is also was incredibly helpful, especially after the baby was born. And I think for us, you know, the first 6 weeks was a complete blur. Even with me having medication on board, I would still be worried. I would still be anxious. And I think that's perhaps, like as a GP, I hear that from a lot of new parents. You know, the first 6 to 8 weeks, you know, they can't remember what had happened. And for me, the things that people did that were really helpful was actually just to drop a meal off, without actually us having to go to the door. So they'll just drop it off at the front door and go and text us saying, oh, by the way, there's something at your door. And that was actually for us a really good gesture, because we didn't actually have to have a conversation. We didn't have to stop what we were doing. We didn't, you know, because routines were all over the shop. So I think things like that can be very helpful. So meals dropped off, or getting groceries delivered for someone, or just a simple text message without them and needing to go, oh, needing to reply. So a lot of the text messages that I got were just let us know when you want to, don't need to reply to this, just wanting to check in to see how you're going. So things like that. So I guess with COVID, it does make it a bit difficult, because a lot of the help that we used to talk about was actually help so that mum can get some sleep or some time out. So it was like either to, you know, to take the baby out for a walk, or to help out with the older child. But I think even with COVID, people can still look at, you know, getting a meal delivered or getting their groceries delivered for someone, or even just checking in via text, or which I think from my experience is a bit better, or I find it a bit better than a phone call, partly because I don't want my phone to ring to wake up the baby. So a text message is great. So yeah, I don't know if you had anything else you wanted to add, Angela, before I sort of lead on to John's story.
Yeah, I think that's perfect. Thank you, Carmen. Thank you for sharing. I think that will be has been really helpful for everyone listening to us. Yeah, so let's jump into John's video, I suppose.
Yeah, so yes, as I mentioned, John actually helped a lot with what I was going through. So he's going to share a bit about what he did to, yeah, or how, well, his perspective on how things had panned out.
It happened very gradually, and from memory, it was when Carmen was 3 months pregnant that I started to notice that she was increasingly worried about the pregnancy. She would constantly check on the baby's movement and worry about what she was eating. I became really concerned when she started to lose sleep because of the anxiety and became really emotional about what could possibly go wrong with the pregnancy. They started to feel my own anxiety, and it was difficult as I had to deal with my own struggles, and at the same time, I had to be supportive and reassuring to Carmen. The real challenge was how to talk to Carmen about her struggles without increasing anxiety. I listened and acknowledged her worries and gave her my reassurance. For example, at the peak of her anxiety, she had a toasted bacon and cheese sandwich. But because of the anxiety, she kept thinking that the bacon was ham. And I had to keep reassuring her that it was bacon and it wasn't ham. Last but not least, to pray together and bring our worries to God. I think despite how we were feeling, we knew for certain that God was in control of the situation and that we could pour out our worries to Him. We only shared our struggles with a few people of whom we were comfortable with, namely people from our life group. They were very supportive and caring just by the way that they had responded, of which would be the other response to someone who's struggling with anxiety. Firstly, they listen and acknowledge the struggle. Then they let us know that we could reach out to them if we wanted to. Please note that they offered but did not insist. And lastly, they let us know that they would keep us in prayer. So, for example, an ideal response would be, I can only imagine how hard it is for you, and please let us know if we could do anything. We'll continue to keep you in prayer. That is all that is needed. I would also like to talk about what is not helpful. What is not helpful is to tell that person not to be anxious, as it would only make the anxiety worse. What is not helpful is to troubleshoot, for example, by asking them what is making them anxious, why are they anxious, what have they done about it, and to whom have they spoken about it. What is not helpful is to start giving them solutions. For example, telling them that they should sleep more, that they should spend more time praying, that they should read about Job. And lastly, it is not helpful to constantly check on that person. For example, to send that person a text message or give them a call every few days to check on them. It can and it would make them feel very uncomfortable. You just have to trust that if you've offered to be available to them, then they would approach you if they want to, and when they're comfortable to. I hope this helps.
All right. Thank you so much, Carmen and Angela, for your time and for sharing all that insightful presentation. I'm sure our listeners, Yeah, really got a lot out of that. Now we'll just move on to our Q&A. There's been a couple of questions that have popped in. So I will read them out, and then whoever feels able to answer that question, they can just go ahead. So the first question that's come in: how do you help a friend who you suspect is suffering with perinatal depression or anxiety, but they present well? So in text responses or over the phone, and continually respond with "Oh, I'm good, everything's fine." So generally superficial responses. I've tried being open from my own experience, for example, acknowledging that it can be very challenging, or I find it hard, especially in that season, and encouraging her and asking her if she's finding anything challenging, but she seems to have pulled away from the community.
Yeah, I can give it a try. So, well, people do say that perinatal depression and anxiety is called the smiling depression because, there is a lot of expectation that, being pregnant, having a baby is a very joyful moment. So I suppose in terms of, caring for this person, I think this person has, the one that's asking the question have done the right things. Consistently check on them and ask them. But I think what you can do is just being there for them, letting them know that you are in it with them. You probably have shared you might want to share some observations. So I think, this area seems challenging for you. Do you need any help? And so on. But we certainly can't force the person to seek help. Carmen, do you want to add anything to that?
Yeah, I think what you've done, or what the person has done, has been pretty much a great response. I think sometimes it's the question to ask perhaps is whether you might be the right person to care for that particular person. So some people just might feel more comfortable with other people, and I suppose it depends on how close you are with that person as well. So if it was my best friend who was going through something like this, then I would be a bit more upfront, saying, I'm a bit worried that, you're, you seem okay, but, just something's worrying me. Like being a bit more open about it. But for example, if it was someone who I didn't really, had a very, maybe superficial relationship with, then I might be thinking, oh, perhaps am I the right person to really say that to them? And as Angela said, just the fact that you're present, you've shared your story, might be all that's needed, and that if they are ready to seek help, then they might actually come back to see you. So being available for them when they do come back will be the best thing.
Okay, great, thank you. Now, second question is, I hear what you're saying about not wanting people to send you Bible verses, but then is it okay to be helpful to send Bible verses?
So for me, I think it's so context specific. I think when I was going through a lot of the worries, people would be telling me about, don't worry, the Philippians, don't worry about everything, or Matthew, things like that. And I think it didn't validate like my own emotions first. So I think the most important thing is, have you actually listened to what someone is going through first, before actually, using a Bible verse, or is that even necessary? So for me, a Bible verse is a bit like a solution to something. It may be an encouragement, but at the same time, I think a lot of the time we might forget to actually validate someone's emotions or feelings before actually going into into the next step. And sometimes all people want to do is actually for someone to go, yeah, that's really tough. I can imagine that would be really hard, and that's all that's needed. And sometimes just trusting that if you know that person well, they probably already know those verses. I mean, for me, I knew those verses, but it just didn't stop me worrying. And what I really appreciated was actually someone just to come alongside me and journey with me with that. I hope that answers the question. If not,
No,
yeah.
thank you for sharing. So just in the context of time, we'll probably just have time for one more question. So can a spouse or a carer see the GP or psychologist together with a partner who has perinatal depression? And how can the carer have exclusive consultation without the partner, as it can be quite a sensitive issue?
So can you repeat that question again? Sorry.
Oh, yes. Yep. Okay, so the question, can a spouse or a carer see the GP or a psychologist together with the partner who has perinatal depression? And how can the carer have exclusive consultation without the partner, as it can be quite a sensitive issue?
So I'm guessing if the partner is worried, or if the so for all intent, if it's mum who has perinatal depression or anxiety, and they've gone to see the GP, and you've gone along, and the partner's gone along with them, then usually as a GP, I would go, would you like to mum? Would you like so and so to come in with with you? Or they would usually get up together and come into the consultation room. And that's one of the ways that a partner can certainly attend a GP consult. Sometimes mums might actually just come without the partner, which I've also had before. But most of the time, usually they come together. Sometimes though, I will go, look, I might just have a chat with so and so by themselves, and ask the partner to just leave for a few moments.
Yeah, so due to in psychology, setting, obviously due to confidentiality, it really I need the consent of, for example, the mom who's probably suffering from the perinatal depression, to allow the partner to come in. So I think in my experience, I probably have only had maybe two moms who would bring the partner to come in, because obviously the focus of the session is for her, and it is the safe space for her. So unless there's like a very specific issue that involves the partner, then sometimes I ask, do you want to invite your husband for the next session? But yeah, it's rare. But for people who are caring, so for example, if your husband is suffering from perinatal depression and you require support, you can still go to the GP and ask for a referral for yourself, so you can get supported for yourself. So like the Gidget Foundation, they provide support for carers as well, of those who are caring for people with mental health issues.
Okay, wonderful. No, thank you, Carmen and Angela. Thank you so much for your time and sharing your insights into perinatal depression and anxiety. And thank you so much, John, for taking the time to share with us his experience today, as how he's helped you, Carmen, as a Christian and as a husband. I'm sure a lot of people have been blessed by your presentation today. Now, if there was anything you missed, do not worry, as this webinar has been recorded and it will be uploaded to the link you see here in the chat window at the bottom of your screen, which is next to the raise hand icon. Now, if you have also any further questions that have not been addressed today, you can also email us at caring.together@crossculture.net.au. So now we will break out into our small discussion groups. Please click on the link that you see in the chat box to join the Zoom meeting. So we will be leaving this meeting window. So I would just like to say thank you everybody for joining us today. And I really hope you enjoy the discussion group. So we'll see you over into the other breakout room. Thank you, Carmen. Thank you, Angela. And we'll see you soon.